Okay, everybody, we're just going to get to it because we have a lot to get through. I know people are going to be continuing to log on, but thank you for joining us. Part 3 in our series. Today it's COVID-19, the impact on Chicago's economy, workplace, and public health. Our last discussion took place on April 7th. Before that, it was the first week in March, and we were just remarking on how much has changed, and we all agreed that this third part of the series was really needed now. It's time for us to reconvene our panel of experts. They're going to provide us with their most up-to-date information and recommendations. So returning to our panel today are Dr. LaMar Hasbrouck, physician and former director of the Illinois Department of Public Health, Jim Kolar, the Central Market Managing Partner at PwC, and Jeff Korzenik, Managing Director and Chief Investment Strategist at Fifth Third Bank. Thanks for coming back. And we are also thrilled to be joined by Ashish Jain, who's a PwC partner and principal in financial services. And always a pleasure to welcome back Dr. Suzette McKinney. She's the CEO of the Illinois Medical District, and she'll be moderating our discussion. A reminder that you can submit questions in the Q&A box that's in the middle of your lower taskbar. There's some quick instructions there for you on the screen. You can also click raise your hand, and that will signal to Suzette that you'd like to ask your question live, and when the time's appropriate, she will unmute you and let you ask the question. Thank you to Fifth Third and PwC for sponsoring today's webinar, and with that, I'm going to turn it over to Dr. McKinney to begin the program.
Thank you, Margaret, and thank you to the Executives Club for having me. Good afternoon, everyone, and thank you so much for joining us, as Margaret has said. And once again, my name is Dr. Suzette McKinney. I am the CEO and Executive Director of the Illinois Medical District, and I am delighted to be with you today moderating this panel, the third in the series of the Executive Club COVID-19 panel discussion and conversation around the impact of COVID-19 on Chicago's economy, workplace, and public health. I think for the sake of time, because there's so much for us to dive into, I'm sure many of you have some amazing questions, so we are just going to jump right in and get started. And I would like to kick off our discussion this morning with Dr. LaMar Hasbrouck. Dr. Hasbrouck, over to you.
Thank you, Suzette. Good afternoon. I feel like it's going to be speed rounds today, so I'll get right to it. Great to join all my panelists again today. So I'm going to be presenting, obviously, the public health perspective on the issue and giving you some updates. I'll start with just a few highlights, and then I'll try to touch on a few salient points that have changed since we last convened together. Just grossly, the numbers were up to 1.5 million folks that we know, over 90,000 deaths here in the U.S. Last time we met, it was about 75,000 or so. And again, that case fatality rate, that is the percentage of folks who actually go on to die, at least here in the States, is about 6%. So that's kind of where we are. Since we last met, we've also had the release of Restore Illinois, which is our state's plan to gradually reopen. And as has been said, really the guidance is to do it gradually, to start low, go slow, kind of monitor as you go, kind of a wait and watch approach. We have a 5-phase approach here. And significant is that through phases 4, the social distancing and the face coverings are considered to be a mainstay. So that is our new normal. That will be our new normal going forward, with stage 5 being fully opened and for business, and that's going to be contingent on a couple of things. One is having a vaccine that's effective. We'll probably talk a little bit about vaccine effectiveness at some point. Also having some effective medications, and also having the sustained numbers going down, not just being flat, but actually the trajectory going down. And some presumed herd immunity as we get more and more people tested, more and more people actually have had experience with the virus. So the plan is great. If you haven't taken a look at it, I'm sure most folks have, but it's online. It's very detailed. I think it's very well done as well. So that's a good resource for everyone. Couple of updates on countermeasures, which is the medications or the vaccines. There are probably more than 100 or so vaccines candidates that are kind of in trials. We talked about this on the first segment about the phases and how you can't really speed it up. There's some things you can kind of move along, and we've done some things in terms of ramping up factories and things to make it and distribute it once it's going, even though we don't really necessarily have a candidate that has been shown to work, some promise but not shown to work. So we're kind of doing things preemptively. So when a candidate breaks through and it shows good immunogenicity, that is, it can evoke a good immune response, then we'll be ready to go and ramp up. We're still talking about a year. We're still talking about 18 months on the very, very fast track if all goes well. So that has been moving along and showing some promise. On the other side, the countermeasures or medications that we talk about, just a couple of quick notes. One is that we do have antiviral medications right now. Some of them, remdesivir, has been tested because it was already on the shelf. It was already kind of had a head start. That's being shown to show some promise. But it's important for the audience to know that antivirals are not cures. What they are is additional medication to help aid your immune system in fighting off infections and viral infections. So what they will basically do is shorten the course of your symptoms and help you to recover faster if you take it early enough. And most antivirals have to be taken within the first couple of days of symptoms or so. So it's not going to be a cure-all. The other thing I'll say is that with vaccines, those are not a cure-all because, number one, although most of us like medicines, most Americans, Illinoisans included, do not like vaccinations. They don't get vaccinated. So I think the rate here, the last I looked at the data for Illinois, it was about 41% of eligible folks get a vaccine. So folks don't like getting vaccines. I don't know why. Maybe it's we need to do more education. Across the nation, it's about 40% as well. And when you get to the younger ages, that is folks 49 and younger, it's actually only 30%. And this was the experience with the last pandemic, H1N1 as well. So just to say that a vaccine won't be a cure, number one, because folks don't get it. And number two, because the vaccine effectiveness, that is how well and how effective the vaccine is, typically ranges between 40 and 60%. So even if everybody got it, we have about 60% protection. So those are things. And then the last thing on the horizon in terms of medications or countermeasures is plasma. That is taking the what we call convalescent plasma or the antibodies in the bodies of those folks who have actually gotten over coronavirus, COVID-19 infection and have antibodies that are protective, taking those, ramping those up, amplifying those, and then actually giving folks the plasma or what we call passive immunity that way. And there's a couple of different ways to do that, but I won't get into the details. So that's kind of where we are in terms of the big picture. And I'm sure we'll get to some of the questions that are going to be more relevant, more directly relevant for reopening business.
Fantastic. Thank you so much, Dr. Hasbrouck. And so now I think we are going to move on to Ashish for a financial update.
Yeah, so from our perspective, one of the key things that coming out of COVID response is not just, so first question is how do you return to work? But I think the bigger question most of the organizations have started to ask is what's the long-term implication and what are the 18, 24-month, 3-year out changes that organizations have to make as they think about COVID response, and how will customer behavior change forever? Will digital be the all-encompassing? What will happen to real estate? What's the future of office? Those are the questions that our clients are asking us to come and share with them. And that's the dialogue I plan to have with Jim around, what does the 3-year outlook look like, knowing that, things will continue to evolve. So thanks for having me.
Excellent. Thank you so much, Ashish. Why don't we move to Jim Kolar as we begin to get into the economics?
Thank you, Suzette. Good to be back, and Jeff will handle the economic side of it. But wanted to share just really since I was last on this panel, the first go around, where we really were dealing with the front end. And then last panel, we had my partners, Shannon Schuyler and Kristen Rivera, kind of talk about the gamut of crisis management, really, initially to mobilize, then to stabilize, and then to strategize. And we're really on the strategize phase. But throughout that, it's been a journey. So we closed our offices March 16th, all of our offices across the country. And that was right on the heels of having to close Chicago because of the orders that were coming. But more and more were coming throughout the country. And we as a firm made a decision to close all of our offices at that point in time. The safety and care of our people is the number one thing that we have had guiding all of our decisions and will continue to do so going forward. But those phases also had us dealing with kind of the personal tragedies, helping people who had been exposed, who may have had relatives exposed, and even our own exposure within our offices, the risks of people that may have been in contact and how to manage that, and really working through that over the 2-week period until we were beyond the 14 days. There was a lot of activity there, and then just really helping people get used to all of us working remotely. So we were certainly remote capable, but getting all of us to work remotely. But now we really moved into, and I'll share more as we get into the Q&A, that strategy phase. How are we going to return to the office? We use that term instead of return to work because everybody's been working, and I think that's the case with a lot of organizations. But returning to an office environment, and we're on the forefront of that. So very involved with that across the 11 offices that I oversee as part of our central market, Chicago being the largest of those, and staying very close to local government, what's happening with the mayor's office, the guidance that will come out of that, staying on top of the medical guidance and the like. That will all be very important in basing those decisions. But like Ashish, also having those conversations with our clients and sharing what we're doing, and also learning from our clients as they may learn from some of the things we're doing. That sharing has been really great, especially in the Chicago community, to have those discussions. So looking forward to today's dialogue. Thank you.
Thank you so much, Jim. And last but not least, Jeffrey Korzenik. Please go ahead.
Thanks very much, Suzette, and thanks everyone for joining us. Our focus has, of course, been on this disconnect between the investment markets and the status of the economy. We think it's once again a lesson that markets are forward-looking and don't necessarily reflect what's actually happening on the ground today. But when we look at what's happening on the ground today, as states start to reopen, you have to come to the conclusion that we're in the process of bottoming out in this economic downturn. Where we go from here and what the implications are for investors and businesses is very much a function of how risk-free that reopening is, how smooth the path is to returning to growth in the economy and returning to restoring the economic activity that was lost, how long that will take, and what the disruptions will be. And we see the disruptions in a number of areas. Essentially, we see we push back a little bit on the theme, everything will be different, because you look at countries like South Korea that have gone through 3 pandemics in 25 years, and people still have restaurants they go out to and movie theaters. But there are going to be differences. We see the lockdowns from the pandemic essentially accelerating some trends that were already in place, and those are going to have far-reaching implications for the economy and different sectors of the economy. The other area where we're focused is studying the labor markets, and we think that there's a very real risk of a repeat of one of the tragedies in the wake of the 2008-2009 downturn, and that is the growth of long-term unemployment, people displaced from industries who do not come back to the labor force. And that is a risk for all of us, whether we're employed or not, because if you have declining labor force participation rates because people drop out, or declining or a very slow return to full employment because people have mismatches between their skills and their geographies, you really run the risk of a very slow growth, which has all sorts of economic and social implications. Thank you.
Thank you, Jeffrey. And we can see that the questions are already beginning to roll in. Our first question that has come in through the chat feature is for Dr. Hasbrouck. But before I pose that question, Dr. Hasbrouck, I am going to ask you a question, something you said, which I of course understand, but I'm not sure if others caught it. So you spoke about the number of cases that we've seen, the number of deaths that we've seen, but you also mentioned a 6% case fatality rate. And for folks who may not have studied public health or may not be familiar with some of the data and the statistics that we capture in public health, why don't you take a moment just to explain to our audience what it means to have a 6% case fatality rate?
Okay, sure. So case fatality rate is a It's also sometimes called a case fatality ratio. Sometimes people call it just the mortality rate. It's really a proportion based on a very, very simple mathematical equation. You basically take all of the cases of any one condition. In this case, we have 90,000, I'm sorry, we have 1.5 million here in the States. And then you take all the deaths, those folks that have died that had confirmed COVID-19, and you basically just look at the percentage, the 90 over the 1.5 million, 90,000 over 1.5 million, and it's a straight calculation times 100, you get a percentage. So what that means is that for every 100 people that have a confirmed diagnosis of COVID-19, 6 of them will die. Now that's important because for every 100 people that have the seasonal flu, 0.1% will die. So it's a 60-fold increase. Actually, a 60-fold increase over when you're comparing it to the seasonal flu. And when we started this whole thing, the thinking was it might be a 20-fold, maybe a 30-fold. Some people still hold to that. If I was to look at the global case fatality rate, it's actually closer to 8. Implying that folks have a better survivability here in the States, maybe because of our medical system or whatever. So that's case fatality rate. It's a very important metric to look at when you're looking at any outbreak or epidemic or pandemic situation, because it speaks to the virility of the bug. How deadly is the bug?
Absolutely. Thank you so much for that clarification. And I just would like to note that the reason why I asked you to provide that clarification is so that folks could get an understanding of just what is happening with COVID-19, especially as you bring up seasonal flu, because that's one of the concerns as we begin to move beyond summer and into the fall months. But I think that segues well into our very first question. And that is, do you anticipate us being able to see a new norm even after a vaccine is developed? And if so, why do you see us continuing the social distancing and the need for cloth facial coverings?
So I started by saying that I hope we'll have a new norm going forward. I think that this pandemic has been a wake-up call for a lot of things, for businesses to think about their technology to work remotely, for businesses to think about contingency planning and continuity of operations plans. I think in terms of us working with public health officials and for us kind of doing things in the workplace or in social settings that can kind of decrease or dampen down the risk for person-to-person transmission. And also for us to really understand, the other wake-up call is to understand that an outbreak anywhere is an outbreak waiting to happen everywhere, because we're we're a global community. And so you just have to jump on a plane and you bring the infection back. So what I'm hoping that happens is we'll be more conscientious in terms of hand hygiene, certainly during flu season. I'm hoping that the culture will change in terms of uptake of vaccinations. There's a lot of vaccine preventable illnesses, as you know, and certainly seasonal flu is, and hopefully, we'll get to a point where coronavirus is. And I'm not talking about the anti-vaxxers. You're always going to have a certain amount of people who just don't want to do vaccines for whatever. But I'm just talking about the general culture, understanding the importance and the protection that's afforded by getting a yearly seasonal vaccine. So I'm hoping some of those things will change. When you're talking about interaction and handshaking and hand washing at work, and you're talking about we love huddle areas, we love conference rooms, we love large meetings and things. So not that those should go away, but that we should do them more conscientiously with really more concern and more focus on how we can dampen down the risk going forward. So I think there should be a new normal. I think what's really gotten us this far has been largely the stay-at-home and social distancing. And there's been a lot of research that has emerged showing that you can cut your risk down by half by actually wearing a face cover. Even though you're doing it to protect others, but when you have this, let's call it a herd face covering, we talk about herd immunity, everybody's doing it. Yes, and you're being protected from others, and it kind of just dampens down everybody's collective risk. So I'm hoping as a medical epidemiologist and physician that we will adopt some new norms. But I was happy to see in the guidance here in Illinois that they really continued that theme of social distancing and wearing face coverings through phase 4. and then when we open up again, then, you know, some of that stuff, I think it's gonna continue to go forward. I think there'll be enough folks in society who will say, if I'm gonna go to a mass gathering or a concert or a ball game, I'm probably gonna cover up. So I think the stigma will drop around that, and that should help to protect most of us.
Sure. And so Jeremy Van Eck actually has a question related to your speaking points about vaccination rates. So when you spoke about vaccination rates and you indicated it's 41% in Illinois,
Yes.
Jeremy is wondering, is that for all vaccine preventable diseases such as polio and measles, mumps, rubella, or is that just for certain vaccines such as the seasonal flu?
Great. So yes, that's just for adults, so 18 and older, and that's just for seasonal flu. And the seasonal flu, most people may not know this, but the seasonal flu actually includes protection from H1N1, which was our last pandemic, swine flu. So that's in the formulation. So for adults, for seasonal flu, their rate is about 40% nationwide and in Illinois. And as you get younger, it goes down to 30%. By the way, older folks over age 60 actually do the best. They're at about 60%.
Excellent. Thank you so much. So our next question is related to the labor market and the workforce. And I'm going to direct this to Jeffrey. What are your predictions for the rehiring of furloughed workers in white collar sectors, if that ever occurs?
Well, there will be rehiring. It's just at what percentage. And I think it depends very much on the industry. To my earlier remarks that the lockdown is accelerating trends that are already in place, I think you have to look at retail as a great example. And we are all ever more reliant on online retail than we ever have been before. Many of the furloughed workers were in retail. It's a large component of the US workforce. And I think it's reasonable to believe that maybe 75% or less of those furloughed workers in that field would come back. Now, you have to offset that with the knowledge that there will be new openings. Amazon is hiring. There's logistics firms that are involved in delivery of online goods sold. All of those places tend to be hiring. The question will be, if workers in traditional retail don't have their jobs return, will they move to those other career paths? And that's still a big question mark.
Sure, thank you. So Jim, our next question comes to you, and it's from Doris Salomon. And she is wondering, what is the strategy for getting people into the office, especially in terms of those who continue to commute on public transportation?
Sure, it's a little bit of a two-part. The first part, our strategy to return to the office. Maybe I'll share kind of our journey on that, and then maybe Ashish may have a comment on that. But really, when we left the office, and that was fairly abrupt, it was March 16th, and we told everybody that was the last day to gather their things and to be prepared to work remotely for an extended period of time. And people have been working remotely for some time in our firm. We really prepared everybody. Everybody had laptops years ago. We had a work from where you choose policy, so you could have flexibility as to where you work. So people were used to that, but nobody was used to everybody, and kind of the necessity of coming into the office had to go away pretty quickly. The other thing that really helped us in that was the investment we made in all 55,000 of our people around technology and tools, and not just collaboration tools, but the ability to actually work and function and deliver for our clients remotely as well. And that really paid off, and it's called our Your Tomorrow strategy. So our people were well equipped, not only from a technology standpoint, but from a knowledge standpoint. But that desire, is still there in terms of people wanting to go back to normal. And we've been away for 8 weeks. So really our strategy starts with kind of our guiding principles. So for us, safety really drives all decisions. The safety of our people is really what guides us. And so we're not in a rush, if you will, to get people back to work. In fact, we're taking it very slow. I think Jeff referenced other clients or other people that would be out there making these decisions and having some caution there. We're going to also follow CDC and local guidelines too. So, with the mayor's plan, bringing it down to earth in Chicago here, the slow return to work might be our first opportunity to go. We will not go any sooner than that. and we will also follow that in terms of slow, and as well as CDC guidelines. And then in terms of our offices, we'll set standards, and they'll be nationwide, not just Chicago. But if any of our people are expected or asked to go to client locations, we will expect that same standard or greater to be in place, and want to make sure, going back to our guiding principles around the safety of our people is the most important, and we'll follow that. And then there are things that we're going to employ, so I'll get into some of that. But with respect to critical supplies, so, you know, testing, if you will, testing's needed at a lot of other critical places, essential workers providing the care and the like. So we will not be a drain on the supplies needed for essential workers. And so we're going to monitor that locally too. So we won't likely have testing, but we'll have, you know, monitoring, we'll have face masks and the like. But if PPE is at a shortage, we're not going to drain that shortage as well. So we'll be very careful about that. And then we've got to go through, we're literally 3 to 4 weeks away from opening any office because of the detailed plans that we're going to have in place. So we are going to have to prepare a market plan. So I oversee 11 offices. It's going to be office by office that actually starts with what are those local guidelines, but really preparing our people and preparing the workplace. So do we have the adequate supplies? Do we have a stream of those supplies that we can support the workforce that needs to come back? And we're actually going to ask all of our people to hotel to not go to the same office that they would have resided in or the same workstation, because we'll have to deploy social distancing. So we have a work plan, and we were largely hotelers, meaning that people checked in to a space and it may not always have been the same space. That's going to be 100% and a requirement. I think the most important thing is that, you know, employing the social distancing, the practices, so all of our people will need to wear a mask. They'll go through some type of screening on the way in, perhaps temperature checks. We'll have to monitor when they come in and how many. For example, the elevator banks, you know, no more than 4 on an elevator is a likely outcome to go up. So having to schedule appointments. And lastly, determining who should be in the office. So we are going to hold our capacity to about 15% of what we normally had when we start out. So people will need to request permission to come into the office, and we're going to have a determining, you know, a filter on that to determine who's most essential, who needs to come in, and then strict adherence to the social distancing guidelines. And then I think lastly, we have some tools, and I can talk about that later, that we'll deploy as well, around contact tracing, as well as, you know, the safety screening on the front end. But I'll pause there. I got a little long-winded on that. So, and Ashish, I don't know if you wanted to add anything to what we're seeing with clients, but that's
I think
our plan.
You probably hit all of them. Everybody's taking it very slow. We expect in next 12 months at max 15% of people coming back. Everybody's thinking about it in waves. And the single biggest thing is employee care. Some of the clients are actually using surveys to understand who really wants to come versus not, and who should come and who shouldn't, because not all jobs need to be in the office. So it's a very staged, very slow, based on all the conversations we have.
Yep, and there was a second part of that question about mass transit. So that is a concern. We haven't fully addressed that yet, but I think it all starts with the personal accountability for your own safety and for everybody's safety. And I don't think we'll be in a position to mandate necessarily that people do or don't take mass transit. I don't think we know what that will look like as people start to return to work. But I anticipate with our need to have staggered arrival times that may help with that. But I think we would encourage all of our people to be as safe outside of the office as inside of the office, and to exercise those same safety precautions as well.
Great. Thank you, Jim. And also thank you, Ashish, for your contribution to that question as well. Our next 2 questions are with regards to testing. So Dr. Hasbrouck, these are coming back to you, but I'm going to try to combine them, and hopefully you can give us a succinct response, but cover both of these questions. So the first question is, does the limited testing capacity or availability make the mortality rate of COVID-19 a false comparison with that of seasonal flu, for example? And then relatedly, does the limited testing availability, actually, it's the same question. It was just registered by two different people. So that's the question, if the limited testing availability makes COVID-19 a false comparison to seasonal.
Okay. Okay, so yeah, two things. One, the case fatality rate is a simple calculation. It is what it is. Now, if you believe it or not, is really gets to the heart of the question. There is underreporting of cases for a couple of reasons. And one is because we're not looking as much. In epidemiology, we call that a surveillance bias. The more you look, the more you find. The less you look, the less you find. Actually, the president actually articulated this in a way in a recent press conference. So yes, because the denominator is smaller than it should be, because we're not doing the case, we're not doing the testing because we're rationing the tests and there's criteria to get tests and there's complaints that there's not enough tests. Yes, that's going to falsely inflate the number of the case fatality rate. However, folks need to also be aware that the death rate is probably higher than we're seeing as well. So that is not, again, believing that is also a concern. Many folks died early in the flu season. We think they may have died of COVID. Many folks die outside of healthcare settings, the poor, folks, people of color, other folks who don't have access to health, they may have died and most likely did die of COVID. So both of those numbers aren't the truth, but it's what we have. So when we calculate the case fatality rate, it's based on what we have. But certainly the more testing we do, the more cases we find, that case fatality rate is going to come down. It's probably going to end up somewhere around 2%, if I had to guess.
Thank you. So Jeffrey, you were talking about concerns with regards to the labor market. And I think, this question I'm going to pose now, I think we actually talked about this in our second session, but I want to go back to it because we obviously know that information has evolved and we know a little bit more than we knew back in early April. So in your opinion, what industries do you think will win and which ones do you think will lose coming out of COVID-19?
I think the clear winners, of course, revolve around the trend towards more reliance on online retailing, online work. All of those will clearly be winners. I think there are some interesting second order effects. If you don't have to go into the office, do you really care how long your commute is, right? I mean, your commute is from your bedroom to your office, and that might change the willingness or desire for people to live in the urban core. So one of the trends we had already been seeing among millennials was a move away from the urban core and towards the suburbs. This could well accelerate that. That has implications for home builders as well as just the general infrastructure of companies that support suburban living. I think one of the losers here will be public transit and companies that focus on public transit. It's interesting, as part of our research into the aftermath of the Spanish flu pandemic of 1918-19, it's interesting the growth of cars associated with that. Public transit ridership in the United States amazingly peaked in 1926. I mean, so there are going to be some disruptive forces in that regard. But I think a lot of it will ultimately revolve around distance buying, distance working, and then the other impact that we expect to see is this stated desire from Washington, and it is bipartisan, to make capitalism less efficient but more robust by moving the supply chain to the degree possible, especially for critical industries like medical goods, back to the United States. So that means the growth of manufacturing, logistics that surround manufacturing, and even the educational resources that are needed to train a new generation to fill those jobs.
So speaking of, I was going to ask Ashish to comment next, but I'd actually like both Ashish and Jeffrey to give us your perspective on what you think about universities. And I'd like to start with Ashish. Do you see universities reopening, and what's the financial impact there?
So before I go there, can I just add to Jeff's point? One of the industries I do think that has a potential to grow is technology innovation. What we are talking to our clients We are clearly seeing desire to collaborate more from a work from home environment. Work from home environment appears to be a trend that will stay here for, which appears to be more permanent after the crisis. And when we talk to our clients, there is a clear need for tools and technologies to enable that. And as a country, innovation is something that we drive and grow on. And we see that, potentially, Jeffrey, I don't know if you would agree, but that will be, I think, an unknown if outcome of this pandemic is how do you collaborate. Coming to your specific questions, Suzette, on university, I think that's a really open question. As you know, there's a real question around the economics of the universities and the economics of the counties and cities that those universities are. How does this impact inflow of students from outside US and what the future looks like? Not a crystal ball, unclear what the long-term impact will be, but in the short term, we definitely see a little bit more pain to universities as students are beginning to defer more. Some of the people we know have started to talk about their kids going a year later. So there's a real 12-month impact. Long-term, not sure. I think there's a potential for disruption from students coming from outside US than within US, but there's definitely an impact in the near term. Off to Jeffrey.
Yeah, and I'll second that. A little bit of an unknown, but I think in many ways, the universities have really lagged the needs of student bodies and seem to have, over the last couple of decades, for nonprofits, they seem to have adopted a for-profit model of charging what the market will bear. And we've saddled a generation with high levels of student debt without really upping their skill level any more than older university degrees did for us. So we're big adherents to what's called Stein's law, named after the economist Herb Stein, who said famously, if something cannot continue, it will not. And so the rise of ever higher tuitions and filling seats at universities, top universities, somehow willing to pay it, or the income transfer that went from foreign students who are paying full boat to subsidize other students, all that can't go on and is going to stop. I think we're also learning and going to have this lesson reinforced that while it is true in aggregate, the higher the degree, the higher the average income, we really have to look at segmenting. Not everyone is meant to go to college. And at a time when relatively high-paying jobs in manufacturing and the trades that don't require college degrees can't fill positions, we've been doing something wrong. And I think this is particularly pertinent to Chicagoland, where prior to the downturn, we had something like 25,000 unfilled manufacturing jobs in greater Chicagoland. If we're going to have the opportunity to recapture some of these manufacturing jobs, and it's not a return to 1948 America, but every job you add in manufacturing tends to create 3 times as many overall job growth. Every dollar value added in manufacturing tends to create $3 of GDP. These are important jobs to fill. We in Chicagoland have to be prepared with the training infrastructure that supports that potential growth.
Thank you, Jeffrey. Jim, I want to go back to you because you were talking about the regional offices that you oversee, and our next question comes from Patricia Knoll, and it's specific to PwC. She wants to know if PwC will be mandating that employees wear masks 100% of the time when they're in the office, even if they're sitting in a private, enclosed space.
Thanks for that question. Yes, we've actually debated it, going back to, the guiding principles, the safety of our people. That will be a non-negotiable condition of people coming back into the office. Even if they are in an enclosed office, they will have to wear a mask the entire time. And we will be asking them to bring them in, but if they don't have them, we'll also provide them. That's an important thing. But again, subject to that, we don't want to be a strain on the supply chain, if you will, for other necessary workers, essential workers that may need them, but we don't think that will be the case by the time we get people in. But
thank you.
Short answer, yes.
And now I want to go back to something Ashish said a few moments ago, talking about digital transformation and the importance of technology moving forward. So Ashish, the question for you here, obviously the pandemic has clearly accelerated digital transformation for many companies. Besides migration to the cloud and heightened cybersecurity, which most companies were forced to do, what do you think companies should be looking to implement next from a technology perspective?
Thanks for asking, Suzette. So in the discussions we are having with our clients, there are 2 or 3 trends we believe that appear to be permanent. One is work from home and ability to work from home. Second is, as you rightly said, the acceleration of digital acceptance. I think Bill Gates said it, the digital transformation has accelerated by 10 years, driven by pandemic. Based on that, there are 3 big themes coming out when we're talking to our clients. First is around collaboration, which is around enhancing tools and technologies that require you as a team to work collaboratively in a hybrid off-office, on-office model. So that's clearly number 1, theme that's coming out. Number 2 theme coming out is how do you digitize your processes? The processes historically have been, simple process like paying payables or payroll payments have been very manual in nature, and we clearly see a trend towards digitization of the processes that run companies and how they have to be less manual and paper-based and more digital. We clearly see that trend. And third, I think related to what Jeffrey was saying is around what we would broadly call distribution. What would the distribution of the future look like, both in the B2B environment where, relationships are so important, how do you build those relationships, but also in, retail environment where, there are branches, there are shops, how would that look different? So those are the big 3 themes that we are seeing from our clients that they're talking about, and how do you drive, next stage of evolution driven by pandemic.
Could I add also, just as a, in the business, one of the things that I'm wrestling with now that I'm working far more digitally with my team is how do you build, for lack of a better word, camaraderie? It used to be in the old days, it was pizza and beer at the office on a Thursday night or a Friday night. How do you do that digitally is a lot more challenging. And all of us have learned that turnover and loss of talent is a huge risk to any business. And one of the ways that you prevent that is through good engagement of your team. And I think that's a little bit harder to do digitally.
Agreed. Thank you so much. And so, we have just about 15 minutes left in our conversation today. So I think I want to begin to turn toward looking at a potential second wave of COVID-19. And Jim, you just had the floor. So Jeffrey just had the floor. So I'm going to stick with you for a moment. And my question to you to start off this last component of our conversation today is, what do you think the economic risks of a second wave of COVID-19 infections could be?
Obviously, having to go into a second shutdown of the nature of where we were would be very harmful. I don't know that would get us quite up to the, it depends when it comes, assuming the fall, how far is our recovery gone by then would tell you how much risk. I do want to push back a little bit, not to negate any of the seriousness of this infection, but we hear a lot people pointing to the Spanish flu pandemic when the second wave, which began in the fall of 1918, was the most deadly. And I'm not sure that's as good an analogy. There are other reasons to fear a second wave. I think a second wave to some degree is coming, but to expect it to be as devastating as that began in 1918, we think is misplaced. Number one, World War I was still going on, pretty hard to practice social distancing and hygiene in the trenches. Number two, troop movements helped accelerate this around the world very, very quickly. Number three, when people did come back, they came back, yes, to an America that was in aggregate less urban, but the urban areas were incredibly densely packed. The population of Manhattan, for instance, in the 1920 census was greater in 1920 than it is today. Chicago's population in 1920 was a little larger than it is today. So you're coming back to these urban areas that had a lot of dense issues. Public transit was higher than today. Public transit use, that's a spreader as well. And then of course, 100 years of medical progress. And a large number of the deaths in the Spanish flu were attributed not to the flu itself, but to bacterial infections. There was, of course, no antibiotics then. So we think that there is a second wave. Is not unreasonable to believe as we open up and people get exposed. Hopefully it can be contained, but to expect it automatically to be as deadly as the second wave of 1918, 1919, we think is misplaced.
Sure. So
Suzette, maybe to maybe add on to that, you know, there's a lot of talk about contact tracing and what that can do.
Yes.
And I would take you back to when this first hit us, one of our larger offices, somebody with a confirmed case may have had us identifying 2,000 people to potentially self-quarantine. And the data that we had to look at was based on badging data, who entered a particular floor, was that person on a floor, and the like. We even have our own tools now that are available in the marketplace, but automatic contact tracing, which is geofenced within our offices only. So it only will trace us when we are within the perimeter of our office space, but it will help us quickly identify where if I've come down and Ashish was within 6 feet of me on a regular basis, and there'll be algorithms in there to identify Ashish, but it's all anonymized data until there's a confirmed case and we have to enact, and that will only be enacted by certain people to identify those that need to be contacted. But I'm using that example because I think there will be a lot more of the ability to use contact tracing to help isolate and minimize risk, not eliminate, but help minimize risk going forward too. So I think a lot of advancements in that area, and we'll be using that tool as well as our own Status Connect tool. It's also available in the market, but it helps with the health screening before anybody comes in and the knowledge using CDC questions and data. But I've seen the technology advancing and helping with that, Jeff, a lot.
So Jim, along those same lines, do you see companies implementing new policies that would reprimand employees who are not practicing good health habits to limit their COVID exposure outside of the office and potentially putting their colleagues at risk?
So that's a great question for us that you know, we're asking ourselves internally, and how do we police this? So for us, it's going to start with that slow return to work and really educating people on the importance of social distancing and practicing what we're asking them to do, wearing the face masks, directional, not congregating, and the like. And I think not that we're going to police it, but I think people will be so aware of that there is this personal responsibility that I will wear a mask every day, and that I have the expectation of my coworkers for my own safety. And I think that will kind of allow for the privilege of those that are in our offices to continue with that privilege. I think if there's repeated or known instances of not following the guidelines, they will likely lose that privilege. But I wouldn't say punitive, but really just, again, coming back to that personal responsibility for my own care and everybody else's care.
Sure. Some have said that this is probably the worst time to be starting a company. So when do you all see deals and investments in startups coming back? And I don't know if Ashish wants to take that, or perhaps Jeffrey might want to address that.
Let me start, and I think, Jeffrey, you can probably answer the question around. We actually are seeing innovation happening as we speak. And the innovation might be different. And as I started saying, as we are talking to our clients, there's a massive amount of opportunity around collaboration. How do you make work from home successful? How do you measure productivity? How do you measure outcomes because you're working remote? So how do you make off-prem, on-prem model work, and the tools and technologies that you require to enable that? How do you make virtual teaming enable? How do you make agile teams work? So we expect in next 6 to 12 months, massive innovation happening, massive money to be going into that. So if I was a startup and I have an idea, which, that's where I would go. And we're clearly seeing that trend. On the deal side, I'll leave it to Jeffrey, but we are clearly seeing innovation happening as we speak, and our clients are looking for it.
And I'll second, it's a great time to be an entrepreneur or an innovator. Disruptions like this create opportunities for those who can see them. There's a long track record of startups, for example, that start in dire economic times, which with our unemployment rate today, I think it's fair to say, tend to do better than those that start up much later in the cycle. And one of the other advantages to starting up now is it tends to free up talent. Among the unemployed, among the disrupted are some incredibly talented, hardworking people who would not normally be willing to take the risk of a startup, but do in these times. So I think the time is right now. I think capital to fund those startups is also available. The people who traditionally take place in that market have not been as impacted in general. And we know that there's a fair amount of cash on the sidelines, and compelling opportunities to innovate at a time of disruption like this, I think can earn that capital.
So Jeffrey, speaking of talent, what advice would you have for graduates that are entering the job market right now?
Okay, here's a tough one. Historically, there is a research that suggests that when you come out in good economic times, your career is better than those that come out in bad economic times. It's a very depressing statistic. I would certainly, if someone can land a great position now, if they're graduating, that's great. But this is also the time to think of grad school or some other way of deferring into a better job market. It's a very cynical answer, but it's the same answer I would give my own children. So there it is.
Ashish, do you think cash will go away after the pandemic?
Great question, Suzanne. Cash, it's so entrenched in the US that we don't expect it to go away. It'll stay, but we definitely see contactless and digital payment ramping up quite rapidly. Predominantly, not just because of consumer behavior changing, which we know it has, but also from a merchant perspective to create that social distancing and create safe policies for their workers in the retail stores, in places where they want to take it. So we definitely see a trend of digital payments going up. We've already seen that. When we look at the data in last 2 months, I think it's gone up by 20 to 30% in that range. And we definitely see that not purely from a demand side consumer, which has been historically where we focus, but also from a supply side where merchants will also potentially change. And we're seeing that, right? We see those policies potentially there for long term as well. So
I'm going to throw on, I'm going to throw on my social justice hat for a moment and just remind our audience that a large number of people, particularly in cities like Chicago, are unbanked. And although banks like ours work to address that, the reality is that there are a large number of people for whom cash is the only means of trade. And you have cities like Philadelphia, which is the poorest of our 10 largest cities in the United States, which have actually forbidden, they've regulated so that so any store has to accept cash. They can't be purely cash free. So I think that's going to also be part of the discussion here and should be part of the discussion.
So we have just about 6 minutes left. I'm going to pose 2 more questions, and I am going to ask you all to try and answer these as quickly as you can. The first, I'll just go with the first person who speaks up. How do you think this pandemic will affect children's learning socially and academically? And I'm asking this question because I can imagine that many of our listeners today and our audience members are parents, and I would imagine that they're very concerned, especially about kids who are learning fundamental skills. So maybe I'll ask 1 or 2 of you just to tackle that quickly, and then my final question I want everyone to address.
Well, I'll jump in since I'm not a pediatrician, obviously, but I have raised 3 daughters, and they're all in school, in college, actually working their last semester from home. So that's a bummer. I hope they get back in the fall. But I will say that there's obviously been a hiccup for those folks because for kids, for young school-age kids. And so there's going to need to be some remediation. I would liken it to what happens after the summer recess. You know, when kids come back from the summer recess, instruction starts to take a step back, bring them all up in the fundamentals and get them going forward. I think the amount of damage or disruption is going to depend on the amount of time. If they can get back to school in the fall, I think I could liken it to summer break. But if not, if it's prolonged, then I think there's going to be prolonged damage. There's also the trauma, the mental trauma about them not being able to engage in play dates and worrying about folks and seeing people around them be concerned with their life and their health. So I think those types of things really mean that parents need to really do a lot of communication and over communication to help their kids understand what's going on, and that giving them some real advice and support.
Thank you, Dr. Hasbrouck. So let's go to the final question now, because I'd like for each of you to address it. And this comes from an audience member. When do you anticipate things going back to normal? So Jim, why don't we start with you?
Sure. Not for a long time, and they may not go back to normal. In fact, we're thinking and hearing from our clients that things will not go back to normal in terms of, especially the workplace. So while we're starting with 15% maximum capacity, you're looking at real estate models and the like, and working with, even our own consultants inside and outside of the firm. What's our real estate profile look like going forward? What will we need? We built a lot of collaboration space and the like, and that may not be needed going forward. Maintaining social distancing, not just for this era, but for the next COVID that emerges, if you will, potentially. How are we building and thinking about that? And lastly, with regard to technology and the advancements that Ashish talked about, how fast technology has moved. So many people are much more aware of the capability they have from working from a different location and with the same or increased productivity. And I would say some even talk about increased productivity. There's no commute anymore. My commute's from my bed to my closet to the shower to the camera here, and that's only about 50 steps. So I don't see it returning to normal, and especially not in the 2 to 3 year horizon. This will be a slow return to the essential parts of the workplace that we need.
Thank you, Jeffrey. Ashish?
Just to build on what Jim said, I think when we talk to our clients, I think, as I said, there are certain assumptions that feel to be more permanent than others. The digital acceptance, the work from home model that has started to work, and also from an employee perspective, employees have suddenly realized this could work. We can have a life, and we can make this work for all of us. So those three things combined, to Jim's point, I think coming out of pandemic is a long way. It's 12 to 18 month journey, but then there are certain trends that are permanent that will change the way we do work, the way we work in offices, the way we collaborate. I think that is a long-term implication for all of us.
Thank you. Jeffrey?
When we return to normal depends on what your definition of normal is, of course, to some degree. But to use two economic metrics, when do we get back to the level of GDP that we had in February? I think that's probably end of next year. But to everyone else's points, it will look different. There will be things that are different. And because of that level of disruption, if you look at the labor markets, when will we get back to 3.5% unemployment? I think that's many years in the future. We're doing a lot of damage to the workforce with these disruptions, with the long-term unemployment that has the threat of developing over this time period. And it may take 4 or 5 years to get back to the kind of labor tightness that we experienced as recently as February.
Thank you, Jeffrey. We just hit our 1 o'clock time frame. Dr. Hasbrouck, I'm sorry I didn't get to you for that question, but what I will say is that Dr. Hasbrouck has published an op-ed on reopening. It's in The Hill, and we have posted that link in the chat box for all of you to follow. So with that, I'll turn it over to Margaret. Thank you.
Hi, thank you all. Thank you, Jeff and Jim and Suzette and LaMar and Ashish. I know our members have become reliant on this series, and so we'll probably want to ask the band to get back together again sometime in June as things continue to evolve, but you're such a trusted panel of experts for our audience. And thank you again to Fifth Third and PwC for sponsoring this program. And then for our members, before we sign off, I just want to remind you to join our LinkedIn group. You'll have gotten an invite from Leslie McDavid, and we're sharing a lot of information there. It's a great space for you to connect with each other and network and continue to share information. And so that's it. Thank you, everyone. Enjoy the rest of your day. Be well.
Thank you.
All right.
Thank you.
Thanks.
Thank you.